Families put a lot of trust in what's called memory care, yet the term has no legal definition in our state. The Alzheimer's Association says that's creating a lot of confusion, inconsistent care, and safety concerns. Jenna Sachs has the Contact 6 report tonight.
She was very social, very outgoing.
Marilyn Theat's mother, Marilyn Brown, was meticulous about her appearance.
She was showered every day. Her hair was done. Her makeup. She wouldn't even go to the grocery store without her makeup done.
So when Theat's mom stopped bathing at her assisted living facility, it was like an alarm bell for her family.
Staff that has training in Alzheimer's and dementia know how to get those patients and residents to do the things that they need to do. But the staff was not trained.
Because Marilyn Brown had vascular dementia, her daughter chose a facility that advertised memory care. However,
not too long after she moved in, I was starting to see things that I was questioning.
Things like a lack of understanding about how the disease progresses.
I was noticing she took a steep drop in her cognition.
In 2009, Thea expressed concern that her mother was unwell.
They dismissed me. She ended up falling. She broke both her shoulder and her hip. Sorry.
Turns out her mom had a UTI, which can cause a fall. Marilyn Brown died 8 weeks later.
At the end of her life, she was in so much pain, physically and emotionally, and I really felt it didn't have to be like that.
Fast forward to today, and the Wisconsin Alzheimer's Association says progress still needs to be made, starting with a legal definition of what offering memory care actually means.
At this point, it unfortunately is an advertising term, and so that's why we want to see legislation like a truth in advertising bill.
In Wisconsin, any licensed community-based residential facility can claim to have memory care, but what that means for residents varies. Of the 12 Midwest states, 9 have laws requiring facilities get special certification or meet specific requirements to operate a memory care unit or wing. Wisconsin is not one of them.
It's up to the facility to decide whether it wants to take additional steps, but it has led to real inconsistencies in quality of care.
The association wants legislation requiring any facility that uses the term memory care to have dementia-specific staff training of 8 hours initially and 4 hours annually. Also a safe, capable physical environment and a tailored care program.
It's important because people with dementia require nuanced care, and they have, they're our most vulnerable, most complex residents of these facilities.
So do providers feel families are being misled?
I don't think that that's a widespread issue.
Wisconsin Assisted Living Association President Mike Pahowski says facilities must already provide, quote, adequate training to staff that's specific to the client group, covering safety risks, disease processes, communication skills, and more, within 90 days of starting employment. If the state requires further dementia training,
it just poses increased staffing challenges, and how can we then pay individuals more when they're potentially maybe doing more.
Pahowski adds the industry is already struggling thanks to low reimbursement rates from the Medicaid waiver program, which he says pay less than the actual cost of care for low-income residents. So if facilities must do more to use the term memory care.
So it's almost kind of like an unfunded mandate. How can we pay that without increased reimbursement from a Medicaid standpoint?
This is my father-in-law, Dennis.
3 years ago,
I thought I went about it much smarter.
Theat was tasked with finding memory care again for her father-in-law.
They said their people were trained and that they were going to do activities specific to memory care. And basically, we moved my in-laws in, and they had none of that.
Dennis Theat had dementia and was supposed to be in a locked wing. That's because 60% of people with dementia wander at some point.
On 2 different occasions, went to visit and found him outside in the parking lot wandering.
He died in January. Now his daughter-in-law is sharing her experiences in hopes of helping those who can't advocate for themselves.
I just don't want anybody else to go through it. It's too late for my mom, but it just wreaks havoc on everyone.
Marilyn Theot is active in the Alzheimer's Association. She filed a civil case against her mother's assisted living facility, and it was settled out of court. The business is now closed. We're not naming her father-in-law's facility because her mother-in-law still lives there. And after multiple ownership changes, Theot says care has improved. I'm Jenna Sachs, Contact 6.